Hi, everyone, and welcome to the North Carolina Health Information Exchange Authority's How to Connect Call webinar and video. So we offer these calls live every month on the last Monday of the month. But if you're unable to attend one of those live webinars, you can view this video pre-recorded on our website. This video will cover how to actually connect to NC HealthConnex, why it's important for providers, the value for providers, and how the connection process works. So here's an overview of what we're going to cover: the North Carolina Health Information Exchange Authority, who we are, how do we work, what does the law mandate, what is the connection process, and our suite of services. So let's talk about the North Carolina Health Information Exchange Authority. The North Carolina Health Information Exchange Authority was created in 2015 by the North Carolina General Assembly to facilitate and oversee the creation of the Health Information Exchange to better serve North Carolina's healthcare providers and their patients. We are part of the North Carolina Department of Information Technology's Data Division. Our technology partner is SAS Institute. That means that SAS Institute manages the technology aspect of the Health Information Exchange, and the Health Information Exchange Authority is the governing body that oversees it. We have a 12-member advisory board that is made up of various healthcare representatives that includes the DHHS secretary, the DIT secretary, and the GDAC director. So what is a health information exchange? As you can see depicted in this graphic on the slide, the Health Information Exchange is a secure electronic network that gives authorized healthcare providers the ability to access and share health-related information across a statewide health information highway. So it is a centralized data repository that allows providers to have access from all aspects of a patient's care in order to better make treatment decisions for those patients. Let's just take a look at NC HealthConnex by the numbers. This is just a way to show you how much NC HealthConnex has grown since it first started. 6 years ago, we had 100 facilities live and connected with 2 million unique patient records. And as you can see by the graphic on the slide, as of Q3 2023, we have over 10,000 facilities live and submitting data, including 145 hospitals, and we have 14 million unique patient records. We are connected to 80 different EHR vendors, and via our connection with eHealth Exchange and the Patient Centered Data Home, we also are connected to 25 plus border and interstate HIEs, including connections to the VA and DoD. The vision for connectivity: this is the vision and the purpose of NC HealthConnex. It's to create communities of connected healthcare providers electronically across the state. As you can see in the graphic on the left, this is how we've always done business, which is filling out releases of information, faxing them to different providers, trying to get that information back. With a health information exchange where everything flows into that central repository that you can see on the right-hand side of the screen, it allows the providers the ability to see the patient's longitudinal record in near real time, improve the quality and safety of healthcare, and deliver services that can provide insight into at-risk patient populations. It provides one central location for providers to view all the available health information on their patients. So what are the benefits of a health information exchange? Well, you can see those listed here on the slide, but it allows healthcare providers to see a more complete picture of a person's health, from medications, ambulatory visits, hospitalizations, and even visits to the emergency room. It reduces staff time spent phoning and faxing other providers involved in a patient's care to track down health information, but it also reduces that patient's time in waiting for that provider to get that information in order to make a treatment decision. It allows timely access to important health events as they happen with the near real-time notifications offered by NC Notify, our event notification service. It gives you improved, more accurate and timely medication reconciliation because you're able to see what's been prescribed by other providers, and access to test results, which reduces costly duplicative tests and gaps in treatment. Let's talk about how NC HealthConnex works. This is an example on this slide of a unidirectional connection. That means the data flows in one way. There are two main types of participation agreements: the full participation agreement and the submission only agreement. The mandate by the state legislature is that providers have to submit clinical and demographic data on state funded patients. That means patients that have North Carolina State Medicaid or the North Carolina State Health Plan for teachers and state employees, as well as state funded grants. The provider enters the information into the EHR just like they normally would in their patient care. The EHR vendor then sends that information to NC HealthConnex one way, and that data is then in NC HealthConnex for other providers. It's important to note that with a submission-only agreement, you do not have access to the clinical portal yourself or to any of our services. In a unidirectional connection with a full participation agreement, the provider still enters the information into the EHR just as they normally would. The EHR vendor then sends that information to NC HealthConnex, but then that provider can also access health information within NC HealthConnex via their web browser. In a bidirectional connection, someone with a full participation agreement still enters that information in the EHR just like they normally would. The EHR then sends that information to NC HealthConnex, but their EHR vendor has that bidirectional capability to actually query and search NC HealthConnex within the EHR so the provider does not have to go to a separate web browser to view the health information. If you're interested in bidirectional connection, you would need to contact your EHR vendor. Please note that while NC HealthConnex does not charge anything for our services, your EHR vendor may charge for this additional capability. This slide talks about who's connected in the state of North Carolina, and as you can see on the map on the right-hand side of the screen, in surrounding states. We have a North Carolina HealthConnex participant map on our website that has icons that shows you which facilities are connected, what kind of facilities, and if you click on that facility, you can actually see what kind of data that facility is submitting. So if you are a provider and you want to know if your local hospital is sending all their information to NC HealthConnex for you to ask, you can search for that hospital on the participant map, or as you can see on the left-hand side, we have a searchable list as well that you can search to find out what information that organization is sending to NC HealthConnex. All of the information that is in blue on these slides is hyperlinked to our website to help you find that information. So let's talk about what does the law mandate. So as we discussed in 2015, the North Carolina General Assembly passed the North Carolina Statewide Health Information Exchange Act. That act created the North Carolina Health Information Exchange Authority in order to oversee the Health Information Exchange Network. That legislation is linked here on this slide for your convenience. The law requires that certain providers that receive state funds in exchange for healthcare services, such as North Carolina Medicaid and State Health Plan and certain state-funded grants, must submit clinical and demographic data by January 1st, 2023. The vision and the purpose is to break down those data silos and improve quality of care and outcomes for all North Carolinians. So let's talk about some important updates that have occurred during the last year. The North Carolina Health Information Exchange Authority has completed a pilot to integrate pharmacy data within the clinical records in NC HealthConnex. Please note that since the pilot has completed as of August 15th, 2023, it may take several months for pharmacies to get connected and before you begin seeing pharmacy data within the NC HealthConnex clinical portal. Also, it is important to note that the enforcement mechanism is temporarily suspended until a bill designating a lead agency responsible for enforcement of the Statewide Health Information Exchange Act is enacted into law. To put that a little more simply, the original language in the bill said that if a provider was not connected, state funds would be withheld from payment until that provider got connected. The enforcement mechanism language has been temporarily suspended until the North Carolina General Assembly can determine who will be responsible for enforcing the Statewide Health Information Exchange Act. The connection deadline of January of this year remains unchanged. In March 2023, the General Assembly received a report outlining the status of organizations that have met or failed to meet the connection submission deadline. To explain that a little more simply, it means that if a provider has signed a participation agreement and is working to connect to NC HealthConnex, they are making a good faith effort to meet the mandate. If a provider has not signed a participation agreement and has not entered into any kind of connection with NC HealthConnex, they are not meeting the mandate. Certain providers are mandated to connect to NC HealthConnex, but not all providers are. Some providers are voluntary, meaning they do not have to connect, are not required, but they may still connect if they want to take advantage of our services. One such example of that is home health agencies. We have lots of home health agencies that are connected to NC HealthConnex because they want access to hospital discharge summaries to help them with their care plans. Those providers do not have to submit data, but they may still connect if they need to for patient care purposes. An example of voluntary providers is listed here on the slide. There's community-based long-term care services, including personal care services, private duty nursing, home health and hospice, IDD providers, CAP services providers, eye and vision service providers, speech, language, and hearing service providers, OT and PT, DME providers, non-emergency medical transport providers, ambulance providers, and local education agencies and school-based health providers. It is important to understand that because these providers are voluntary, you may not see their data inside NC HealthConnex, as these providers are not required to submit data. So how do providers meet the mandate? The first step is to sign that participation agreement. Again, as we've discussed, there's two main types of agreement, the full participation agreement and the submission only agreement. The full participation agreement includes a business associate agreement, which covers both the organization and NC HealthConnex under HIPAA so that that organization may access patient information. The submission only agreement does not include a business associate agreement and allows the provider to only send that state funded data. Now, again, as NC HealthConnex does not charge for our services, your EHR vendor may still charge you to filter out all your patient data that is not state funded. The second step in meeting the mandate is to make sure that you have an EHR system or electronic health record. You need to have an EHR that can send HL7 messages version 2.0 or higher and/or CCDs. What you see here is a data target for patient information. This is the information that we ask for you to submit to NC HealthConnex. We understand that you may not collect all of this data, but we ask that you send the most robust set of data that you are able to. In the dark blue, you see the patient information. In the green, you see the encounter information. And in the light blue, you see the clinical information. Please note that all of this information is listed in more detail in our NC HealthConnex onboarding packet and technical specifications, which is linked on this slide for your convenience. Now let's talk about the privacy and security of the Health Information Exchange. NC HealthConnex is a secure private network. We are compliant with all federal and state privacy and security laws. Information is encrypted and sent over a private network. It will not be sold or shared outside of those that have entered into data sharing agreements with the Health Information Exchange Authority. User access is one of the ways in which we protect our patient information. We take our role as data stewards very seriously, and we expect our participants will as well. One of the ways that we do that is with role-based access controls. Your participant account administrator, who is the person in your organization who is responsible for assigning roles to users, will determine what level of access you need in regards to patient information within NC HealthConnex. The participant account administrator is a very important person in your organization because that person is one of the points of contact for NC HealthConnex, but they are also the user that actually requests access for all the providers and support staff within your organization and what level of access those users need. That is also the person who once a quarter will need to fill out the quarterly user attestation, which is simply reviewing a list of users within your organization and making sure that those users do still need access to NC HealthConnex. The participant account administrator is also responsible for monitoring for any abnormal activity within their organization. Access to patient information is granted only if there is an established treatment relationship with the patient. You can see linked on this slide our privacy and security policies, which are also available on our website. It is important to note that we do not accept 42 CFR Part 2 data, which is substance use disorder treatment data, or psychotherapy notes. That does not mean that behavioral health providers do not have to connect. They are still a mandatory provider. It is just that you will not see substance use disorder treatment or psychotherapy notes within NC HealthConnex. Behavioral health providers still submit clinical and demographic information. Let's talk about the opt-out. So North Carolina is an opt-out state since 2012. That means that all patients are opted into the Health Information Exchange for HIPAA-approved treatment, payment, and operations purposes across all information exchanges. The Health Information Exchange Act requires participating healthcare providers to provide education materials to patients on the benefits of Health Information Exchange and their right to opt out of exchange. So just to explain this a little more simply, the mandate is that all state-funded data, so the North Carolina State Health Plan, Medicaid state-funded grants, that patient information has to be sent to NC HealthConnex. So for example, I'm a state employee, all of my data is inside HealthConnex. If I did not want my data to be viewed by my provider, I could go on the website, find the opt-out form, print it out, fill it out, mail it into NC HealthConnex. NC HealthConnex will process that form, and then my data will be suppressed from view. It's important to note that the patient filling out an opt-out form does not prevent the provider from submitting the data. It just prevents that data from being viewed by providers. If a patient decides that they would like their providers to have access to the health information data, they can always fill out that same opt-out form and just put that they want to rescind their opt-out. So let's talk about the connection process. So, as we've discussed already, the first step is to sign a participation agreement. Those participation agreements are located on our website. You can search, and it's also under for providers. You fill out that participation agreement and then you email it to hiea@nc.gov. Once we receive that agreement, it will take about approximately 4 to 6 weeks for that agreement to be processed and returned to you. At that point, you can go ahead and begin accessing services. If you have a full participation agreement, you do not need to wait until you are live and submitting data. Let's look at some parts of the participation agreement. You see here on the screen where it's got the primary contact and the alternate contact. These are the points of contact for your organization. If you are a solo practice, you may want to enter your personal information in the alternate contact so that if we cannot get in touch with you through your business email or phone, we have an alternate form of contacting you. Here you see the information for the participant account administrator. Remember, this is the person that we will reach out to if we have any questions or if there is a problem with your account. This is the person responsible for assigning portal credentials for your staff, for setting up security questions, for user self-service and resetting passwords, deactivating user accounts when someone leaves your practice. And we have a participant account administrator reference guide available on our website as well as a training module. You also see on the bottom of the screen the technical services contact. If you work in a large organization, you may have your own IT department, and this may be your technical services contact. If not, it may be your point of contact with your EHR vendor. This part of the participation agreement asks what type of organization you have. Is it an ambulatory, outpatient, hospital, pharmacy? It also asks what type of providers you have, your organizational MPI number, and then how many locations you have. Please note that if you have more than one location, you may need to fill out the attachment for participating entity list. This part of the participation agreement asks if your organization provides substance use disorder treatment. Please note that if you do, that does not necessarily preclude you from participating in NC HealthConnex, but also remember that we do not accept 42 CFR Part 2 data or psychotherapy notes. So if you are someone who provides both behavioral health treatment and substance use disorder treatment, you may need to filter your data. Also, on the bottom of the screen, you see where we're asking for your electronic health record vendor information. So who is your EHR vendor, like eClinicalWorks, Point Click Care, Epic, and then which vendor product and version that you have. This will help us in the connection process. You see on this slide the attachment for participating entities and facility locations list that I spoke about earlier. You only need to worry about this if you have more than one location. And please remember that if you have any questions while you're filling out your participation agreement, or if you have questions about attachment 4, you can email us at hiea@nc.gov. Now let's talk about the connection process. The first step is to sign the participation agreement. As I stated, it may take 4 to 6 weeks for that agreement to be processed. At that point, you will receive an email from NC HealthConnex that includes your welcome packet, that includes patient education information, FAQs, and talking points for your staff. At that point, you can begin enrolling in services. If you want to enroll in NC Notify, our event notification service, if you do not have DSM and you want to enroll in DSM, you can do it at that point. You do not have to be live and sending data before you can access our services. When it is your turn in the queue, you will receive an email from us asking you to complete the connection scoping checklist. That will be the point at which your connection project is beginning. Our technical partner will work with your EHR vendor to begin developing and testing your connection to NC HealthConnex. When it is finished and you're successfully submitting data, you will be considered live and in production. And then, of course, you will have ongoing support from SAS, our technical partner, as well as NC HealthConnex staff if you have any questions. So let's talk about the services that NC HealthConnex offers. You can see all those services listed here on this slide for your convenience. We'll go over a couple of these services in more detail. NC Notify, our event notification service, notifies providers if their patient receives care across the NC HealthConnex participant base. This information includes ADT messages or admission discharge transfer to notify you that your patient has been admitted to a hospital, urgent care, had radiology done, and it includes different locations, services, ambulatory, and acute settings. For more information, you can see the YouTube video linked on the slide. Some of the benefits of having NC Notify: providers get notified when their patients receive care in other settings. It helps them schedule follow-up appointments with patients for transitional care management. It helps them follow up on medications that were prescribed or other discharge instructions. Insight to provide continuity of care and reduce avoidable readmissions. Insight into achieving financial goals under value-based care contracts or for provider as a member of an ACO. And it can assist with compliance with state and federal quality initiatives, including meaningful use and promoting interoperability. If you would like to know more information about NC Notify, you can view our website or you can email hiea@nc.gov. If you already have an existing login for the North Carolina Controlled Substance Reporting System, or as some of you may know it, PMP Aware, you can access the CSRS within the NC HealthConnex portal. You'll be able to see it on your dashboard, and it's just a service that we provide so that you do not have to go to a separate web browser to access the Controlled Substance Reporting System. Direct Secure Messaging is a secure email service that allows providers to message other providers on a secure network. Most providers have direct secure messaging or DSM through their EHR vendor. However, if you do not, we offer DSM within the NC HealthConnex clinical portal, again, free of charge. This gives providers a way to message other providers if they have questions regarding care. For example, if a primary care doctor sends a patient for an MRI and they want to ask that radiologist if they need to send that patient to neurosurgery or to pain management, they could message that provider on direct secure messaging and ask the questions they have about that MRI. Let's talk about some user testimonials, some value that other providers get from NC HealthConnex. So one here says, I use the portal to look up labs, test results, consult notes from other providers for quality reporting. This data is provided to insurance companies and other agencies. I also use it to see if the patient has changed practices or seen specialists. It provides an accurate picture of where the patient has been in their healthcare journey while also saving valuable time and research. And then another FQHC participant says, with services like NC Notify, the entire care team can have much needed information to keep patients safe during the riskiest times, such as when they transition between one care entity and another. We offer many training opportunities for our participants. We have training modules on our website that are linked here on the slide. We also offer live training with one of our business development outreach specialists that will help show you how to utilize NC HealthConnex. You can fill out a training request form linked here on the slide, also available on our website. And then once a quarter, we offer teletown hall webinars. NC HealthConnex How to Connect calls are kind of the introduction to NC HealthConnex, whereas the teletown halls actually kind of take it to the next level and show providers how to utilize NC HealthConnex and how to best benefit from the service. So what are the steps to get connected to NC HealthConnex? The first step is to sign a participation agreement and then send that signed participation agreement to the Health Information Exchange Authority at hiea@nc.gov. Once that participation agreement has been executed and returned to you, if you have a full participation agreement, you can go ahead and begin utilizing our suite of services. When it is your turn in the queue, we will contact you to complete the connection scoping checklist and start your connection project. If you have any questions, please contact us at hiea@nc.gov. And for more information, you can visit our website, www.nchealthconnex.gov.